This section explains what to expect if you are sent to see an obstetrician or gynecologist.
If you are a woman, you may be referred to one of these doctors. They are experts in taking care of women. These doctors can help you when you are pregnant, providing prenatal care. This is very important if you are going to have a baby. Your baby will be healthier if you have prenatal care. These doctors can also help with other health issues that only women have, such as menstruation or menopause. These health professionals and other doctors and nurses can help you with family planning. Family planning is important so you will only get pregnant when you are ready and can have only the number of children that you want to have. Mrs. Lee has chosen to have just 2 children and practices family planning with the help of her doctor. How many children you have is your decision. You have a choice about how much time to wait between one child and your next pregnancy. Talk to your doctor or nurse anytime you want information about family planning.
In the United States, doctors want women to have a test called a pap smear or pelvic exam at least once every few years. This procedure is done to be sure that you don't have cancer in the childbearing parts of your body. You can ask to have this procedure done by a woman doctor if that is more comfortable for you. When you have a pelvic exam, first a nurse will ask you about your health. You will go into the exam room and the nurse will ask you to remove all of your clothing and put on a paper dress she will give you. She will leave the room so that you can have privacy while you take off your clothes and put on the paper dress with the opening in the front. You should then lay down on the table and put the paper sheet over your legs and stomach. Your bottom should be on the edge of the table, and you will let your knees fall down to the side of the table. When the doctor comes into the room, she will help you put your feet into holders at the end of the table so that your knees are up in the air. The doctor or nurse will look at your vaginal area to see if you have any signs of infection or other problems. The doctor or nurse will then slide a thin piece of plastic or metal that looks like a duck's bill into your vagina to check inside your body. During the procedure, the nurse or doctor will use a small brush to wipe your cervix, the opening to your womb, and take a sample of it. There will probably be a short pinching feeling when this happens. The sample from your womb will be sent to a laboratory to make sure there is no cancer inside your womb. After the doctor or nurse has taken the sample from you, they will check your tubes, ovaries, and uterus or womb by putting 2 of their gloved fingers inside your vagina. With their other hand, they will press down on your abdomen on the outside to feel for any lumps or pain. This only takes a few minutes. If you have any questions during any part of the procedure, be sure to ask the doctor or nurse. When the doctor or nurse is finished, the procedure is over and you will be able to sit up and put your clothes back on. Most of these procedures do not find any cancer or other problems, but your doctor will call you to tell you if they have found any problems.